Welcome to episode 5 of For the Good of Men podcast, your go-to source for all things men's health. In this episode, we will be joined by Chris, our designated clinical case manager. Chris will be discussing with us climax control, intracavernosal injection techniques, and we will go over how to book an appointment with a clinical case manager at menMD. After this discussion, we will be answering a few listener questions, so grab your headphones, sit back, and get ready for an informative discussion on men's health. To start the show, as promised, we have a very special guest joining us today. His name is Chris, and he is our clinical case manager here at menMD. Our patients set up appointments with him to discuss all kinds of topics. We will discuss a few of those topics with him here today. Hi, Chris. Welcome to the show. How are you doing today?
I'm doing great. Thanks for having me on the show.
It is our pleasure to have you, and I'm excited to discuss with you these next topics. Now let's get into climax control and how that can affect a patient. What is climax control?
Climax control refers to techniques and methods used to delay ejaculation during sexual activity, often to enhance sexual performance and satisfaction for both partners. It's commonly discussed in the context of treating premature ejaculation as a condition where ejaculation occurs sooner than desired.
Oh, okay. And what are some techniques to manage early ejaculation?
There are a few options, of course. First, behavioral techniques such as start and stop method. This involves stimulating the penis until the individual feels really close to ejaculation, then stopping all stimulation until the feeling subsides. This process is repeated several times before allowing ejaculation. Secondly, Kegel exercises. Kegel exercises strengthen the pelvic floor muscles. Regular Kegel exercises can help men gain better control over ejaculation. And lastly, a pharmaceutical approach, which uses topical anesthetics. Creams or sprays containing anesthetic agents can be applied to the penis to decrease sensation and delay ejaculation. We sell the Promescent spray. And what's basically it'll help delay things, and it can be applied by men very easily. Um, Also, myhixel and the off-label uses of PDE5s, such as the generic Viagra's or Cialis's, which will be called sildenafil and tadalafil, for premature ejaculation.
Oh, how can patients use the MyXL and the off-label use for PDE5 inhibitors for premature ejaculation?
Well, myhixel is a sexual wellness program that combines an online program and a device to help men control and prolong ejaculation. The program is designed for men who ejaculate in less than 3 minutes during penetrative sex, but can also help men moderate issues or those who want to learn how to control ejaculation. MyHixel is intended to improve sexual health and intimate experiences. PDE5, such as tadalafil and sildenafil, can be effective in treating premature ejaculation associated with erectile dysfunction. PDE5 receptors are found in the male reproductive tracts, contractile tissue, and accessory glands. And inhibiting them with the PDE5 can increase ejaculatory latency.
Great. Thank you, Chris. If premature ejaculation is causing significant distress or affecting your relationship, it may be beneficial to consult with a healthcare professional. They can provide guidance, support, and treatment options tailored to your specific needs. Climax control is an important aspect of sexual health for many men. By exploring various techniques and seeking professional help when necessary, men can achieve better control over ejaculation, leading to more satisfying sexual experiences for both themselves and their partners. So now, Chris, what about anorgasmia? Can you share a little bit about it and what it does?
First, let's define anorgasmia. Anorgasmia, also known as male orgasm disorder or delayed ejaculation, is a condition where a man has difficulty achieving orgasm despite sufficient sexual stimulation and desire. This can be incredibly frustrating and distressing, affecting both the individual and their relationships. Anorgasmia can be caused by a variety of factors, which can be broadly categorized in psychological, medical, medication related, lifestyle factors. Psychological factors include anxiety, stress, depression, trauma, neurological disorders, diabetes, hormonal imbalances, medications such as antidepressants, antipsychotics, and blood pressure medications, and lifestyle factors such as alcohol and smoking.
Thanks for that information. Now, moving on to the next topic, injection technique for intracavernosal injections. Can you give us a brief overview of what intracavernosal injections are and why they're used?
Certainly, intracavernosal injections involving the injection of medication directly into the corpus cavernosa of the penis. These medications typically are prostadil, papaverine, phentolamine, or a combination of the drugs known as bimix and trimix, help increase blood flow to the penis, resulting in an erection. This method is often used when oral medications like Viagra and Cialis are ineffective and unsuitable due to the side effects or contraindications.
Oh, that's really helpful. Now let's get into the technique itself, Chris. What are the steps involved in performing an intracavernosal injection correctly?
Absolutely. Proper technique is crucial for both safety and effectiveness. Here are the steps in preparation. First of all, you want to always make sure you wash your hands and start by thoroughly washing the hands with soap and water to prevent the infection. Gather supplies up. You'll need your sterile syringe, the prescribed medication, your alcohol swabs, and your sharps disposal container. Drying the medication out. You got to check the medication, inspect the vial for the expiration date and any particulates or discoloration in the vial. Prepare your syringe, attach a new sterile needle to the syringe. Draw air into the syringe, pull back the plunger to draw the air into the syringe equally with the prescribed dose. Sometimes you could do a little bit more, and that's fine. You just want to make sure that when you do put the volume that's intended to be injected, that's where you end up with. Inject air into the vial, insert the needle, and inject the air into the vial. This makes it easier to draw out the medication. Invert the vial and draw it to the prescribed amount or medication into the syringe. Tap the syringe to remove the air bubbles and push the plunger slightly to expel them. The injection should be done on the sides of the penis, avoiding the top and the bottom and the head, of course. Alternate sides when in each injection to prevent tissue damage. So if you do it on the left side tonight, do it on the right side the next night. Use the alcohol swab to clean the injection site thoroughly, and then we're going to pierce the skin. Now, when we go to pierce the skin, we got to make sure that we're holding our penis straight out, and we're going to go straight in on the side at what would be the 3 o'clock or 9 o'clock position if you're looking at a clock on the wall. So this way, we're avoiding the top or the bottom side of the penis. We're going straight in the side. You're going to push the needle in slightly if it's the longer needle before you penetrate all the way to the skin, which would be the longer needle will be our 1/2 inch. So we're just going into where we're just about to touch the skin with the plastic. So most of the metal is in there. And you want to leave the width of a dime, or the thickness of a dime on the side. And you would slowly inject that medication in. Take the needle out after you've injected all the medication in. Apply the alcohol swab that you have and hold it on the injection site for 2.5 to 3 minutes. This lessens the chance of bruising or bumps or lumps. If you have the shorter needle, which is the 5/16 of an inch needle, you're going to push that in firmly enough that it makes a clear indentation into the skin. Because this is shorter, we do need to push it a little bit deeper most of the times. So when you push it in, you'll see the hub. Hub is the plastic where that connects the syringe and the needle together, and you want to bury that hub into the skin and then slowly inject it. Repeat the same process you would do with the longer needle. Pull it out, apply the alcohol swab to the injection site, hold it for 2.5 to 3 minutes.
And after that is done, you wait 5 to 15 minutes and you should be good to go?
Yes, 5 to 15 minutes should be adequate.
Ah, thank you, Chris, for covering that process in depth. If patients still need help with the medicine, there are a few ways they can do so to receive that help. First, we recommend viewing our all intracavernosal injection therapy demonstrations. This demonstration video is available on both menMD YouTube channel as well as menMD.com on relevant intracavernosal injection product page. If you prefer to schedule an appointment, please visit menMD.com, scroll down to the bottom, click Book an Appointment, click Get Started, then click menMD Treatment Support, and proceed to set up a secure account. Once the account is created, you will then pick a time slot from the available calendar appointments. Once booked, the clinician, Chris, will reach out to you and help you with your questions regarding your medication. Now, we're going to discuss some of the questions submitted by our listeners. As always, these questions are submitted anonymously, and if you'd like to ask your own question, you may do so by visiting to menMD.com/podcast. Starting off with our first listener question, this person added, my injection medicine was working for years, and now all of a sudden it's not working like it used to work. What could be happening? Now, Chris, do you have an answer for this lovely listener?
It's actually a question I get quite a lot, especially when patients have been injecting for 5, 10, even 20 plus years. All of a sudden, the medicine isn't working for them. It could be a couple of different things. Typically, it is the medication. Maybe we need to get something stronger, but a lot of times we find out that it's actually the injection technique that they've gotten used to, but we need to have an alternative technique in order to see if that truly is the medication versus them just not pushing it to the proper depth.
Yeah, it's great that they reached out about this, and thank you so much for answering that. Our second listener question revolves around anorgasmia. This person is asking, what is anorgasmia in men and how do we treat it? So, Chris, how would we treat anorgasmia? I know we touched a little bit on what it is at the beginning of the show, but how do we treat it?
Well, typically we can treat it with the medication that they have. So this is something that does happen to sometimes up to 40% of men who use, whether it be the injection therapy or the tablet medications, tadalafils and Cialis, which are Cialis, and the Viagras, which are sildenafil generics. It can happen really out of nowhere a lot of times. And so what they recognize is like over the last several times, they haven't been able to ejaculate. And the lack of ejaculation can be very frustrating because, having sex, that's one of the best parts of it. Well, what we would do is in regards to the injection therapy, we would tell them to start lowering their dosage by a couple of units at a time because we want to maintain the erection that we have, but we also want to get some of that sensitivity back. In regards to the tablet medications, there's really nothing you could do there, but that technique of lowering it is really what seems to work for most people. And unfortunately, if you can't get to that point, then we have to look at other steps, such as sex therapy with a sexual therapist. It can help address psychological factors, improve sexual communication between partners. Cognitive behavior therapy, CBT as it's known as, can help manage anxiety, depression, and other mental conditions affecting sexual function. Lastly, lifestyle modification, which means, like reduce your alcohol intake. Because believe it or not, these things can affect you. Limiting and eliminating these substances can improve sexual response. Stopping smoking, or at least really bringing it down as far as how often you're smoking, can improve blood flow and nerve function. Regular physical activities, a healthy diet can enhance overall health and sexual function. Moreover, in some cases, medications like dopamine agonist may be prescribed to help improve sexual function. If low testosterone is identified, definitely testosterone therapy may be considered. Also, in regards to some things that a lot of times people don't realize is that pornography can affect your overall sexual desire. When you're watching these videos, it can definitely have an effect on you that a lot of people don't even realize.
Wow, that's really good insight. Thank you so much, Chris, for joining us today on this episode. It was wonderful talking with you, and I'm glad that we were able to provide all this wonderful information and answers to our listeners. I thank you so much.
It was great being here.
As we come to the end of today's episode, I want to emphasize that climax control is important to men's health, especially in relationships. And emphasize as well as the importance of reaching out to Chris or your healthcare provider in case of any questions or concerns regarding any current treatments. Thank you for joining us on this episode. If you found this discussion helpful, please subscribe and share with others. If you're interested in sending us your questions about any topics, please go to menMD/podcast. Until next time, take care of yourselves and continue on your journey to optimal health.